We're here to present Virtual Prenatal Care Reimagined, and this is being done by Jamaica Hospital Medical Center Women's Health Division. Centering Pregnancy began at Jamaica Hospital in 2013. It was a program that was well received. People really felt such warmth and care and connection. The COVID-19 pandemic started, and that really put a stop to the in-person groups. Patients now were feeling a little more displaced and disconnected, and we had to find a way to reintroduce this program. Centering Pregnancy offered a $5,000 grant to help bridge the gap, and at that time we started brainstorming on how we could then recreate such a program that had been so vital to our community. In our population, virtual group pregnancy models weren't being offered at all. Now we were at the crossroad where we're being able to offer the virtual group model, but there are patients, no matter how you slice it or dice it, that did not want to be involved in that. They just wanted to have one-on-one visits. And so for those patients, we created a virtual individual prenatal program. And that required us to take lessons that we had learned from Centering Pregnancy and now create a new model for these patients. So we created different flow charts that would help a patient to stay on target as to what was needed at each gestational age, stage, and visit. They were going to know when their ultrasounds were needed, vaccinations were needed, blood needed to be drawn, and that really helped to keep our patients engaged and helped us to be more accountable in their care. So building a virtual prenatal care program, the first thing I would say is choosing a group coordinator is essential to the success of your program. At this also, you want to make sure your providers are advised about the availability of the program and the merits that this option will give to your patients. Recruitment starts at the first prenatal visit. And you will look and you'll see patients that fit the bill that will be a good candidate for this kind of prenatal care. Patients interested are usually contacted and be invited for orientation about 12 to 15 weeks. And that orientation is done in person, and then they'll start their first visit at about 16 weeks.
Now we were at the point where we needed to put together the bag of equipment that we needed for our patients to do proper prenatal care at home. Included in this bag were the scale, fetal Doppler, blood pressure monitor, urine dipstick, tape measure, cups, and gloves. We later realized that we also needed to add a thermometer to this bag.
Here we are now for the program setup. So as I said before, a big part of this program, recruitment. We needed all hands on deck, all our staff that had now been apprised of the program, or coordinator. That's the big thing, is getting patients engaged and excited about the program. Orientation is the next step, and so once patients had been vetted and known to be good for the program, they would come in for orientation. And orientation was run by medical assistant and a mid-level provider. So for each piece of equipment that we gave to these patients, we wanted to make sure that they knew exactly how to use it. And so each piece of equipment was set up as a station. The patient would go through that area and be taught how to do it. They would have to teach back to the provider, and then the mid-level provider would specifically go over the aspects of fundal height measurement and using the Doppler to find the fetal heartbeat, and until the patient had shown us appropriate mastery of the skill. The other thing that was important for our program with our electronic medical record was the MyChart sign-up. So to be able to have those vital signs flow right into the medical record, we needed those patients to sign up in MyChart, and that you'd have less risk of there being errors made in that transcription. The other thing that we realized is that after this orientation, when patients would come back on, they would have moments where they had no recollection of what had been done. And so we then set up online support videos going through each step, all the things we had taught them, the blood pressure monitoring, checking their urine, fundal height measurement, and measuring the fetal heartbeat.
Additional prenatal resource videos were created and uploaded to our educational page, going over nutrition, labor positions and support, and breastfeeding.
So the platform we used was Zoom. Now, Centering Pregnancy had a curriculum that was robust. We had all those sessions sort of mapped out clearly, and so for those, it was much more streamlined in terms of the approach. But to get those patients their one-on-one time, we used the breakout rooms. And again, the curricula from Centering Pregnancy was one that was robust. You still had the camaraderie and the support from others in the group, and that was perfect. Now with the virtual individual prenatal care program, this was just one-on-one with the provider. And to make this program a little more robust, comparing it to the centering program, we added things such as the social services consult that the patient was going to have, and this could be done virtually. They had a nutrition consult. We made sure there was dental in there. All these were built in to make the program a little more centered on the patient and less isolating. So where are we now? So virtual centering pregnancy continues to thrive and grow. Patients have formed meaningful relationships, and when we look back at the centering pregnancy in person as compared to the centering pregnancy, the virtual model, the big difference would be that patients loved both models, but we found a greater retention, especially toward the end, in patients in the virtual model. And again, it could be secondary to that they didn't have to travel. It could be that childcare wasn't an issue. Just more convenient is what I believe it is. The success of this program really has caused us to give thought to how we can extend this kind of care to our high-risk patients. We have one scenario where triplet moms actually snuck into the groups just to really get a group sense as they were going through their high-risk journey. And so this is something we want to be able to offer. Now, the virtual individual prenatal care was less desirable in our population. Now, to recruit has been much more difficult, and especially with COVID cases going down, patients have not really been interested in jumping into this model. Patients reported feeling more isolated and disconnected. Even with the different supports that we tried to build into the program, it did not seem to give them the same group feel that Centering Pregnancy did in the group setting. So the success of our program has garnered interest from not only Centering Pregnancy, to whom which we have served as consultants in developing virtual programs, but the Department of Health has also requested that we do some of that same work in helping them set the framework for other practices to follow this model. The buzz of our patient satisfaction has also led to local news coverage, which has given our patients the opportunity to share with the community the virtues of virtual prenatal care. Now, one could say, if prenatal care could be done virtually all along, why didn't we do it? But it really took this pandemic, taking this experience and changing it into an opportunity to open the door for this. I have here with me Patricia Fox, one of our midwives, who is a facilitator in our centering program. And Tricia, what have you noticed about the patients in terms of their feedback about virtual centering?
Oh, feedback for virtual centering has been overall very, very positive. The patients report maintaining friendships with people who are in their centering group throughout their pregnancy and then beyond. And they feel like they've learned a lot. They feel like they have better access to their providers. They take more agency over their prenatal care. And it's overall, they feel very supported and more confident.
So in closing, thank you. And if there's anything we can do from Jamaica Hospital to support you in starting your program, let us know.